In this case, we see that the patient has some severe decay both between the teeth and around the gum line. It's very important that all the decay be removed, otherwise it will just continue to grow under the filling material. In this sequence we see checking for decay around the gum line, and it's very important to check every tooth. In this case, some drilling was necessary for the complete removal of decay. You might notice that the drill has a light in it, which actually gives us better vision. In this case, we see that a blue rubber dam has been applied around the teeth in order to isolate them from the saliva. Next, a conditioning solution is being applied to the teeth. The purpose of the conditioning solution is to make the composite resins adhere better. It is then washed and dried, and then we are ready to apply the composite resin. First, a very light, thin resin is applied to the tooth, and that will be cured. The ultraviolet light is applied to the tooth, which actually hardens the first layer of composite resin. Next, we add a thicker, more viscous layer of resin. You'll notice that it's put in inside what we call a crown form, which is going to replace the actual form of the tooth. The excess is scraped away, and it's sculptured into the shape of the original tooth. This heavy-bodied resin is now cured with the ultraviolet light. After this, the crown form is removed, and the tooth is shaped with hand instruments, and then eventually drills. We then continue the finishing process with a series of discs. After the disking procedure, we use some fine abrasive strips to smooth the areas between the teeth. You'll note that there's still a space between the teeth, and we are now going to proceed to close that space. What we're going to do essentially is the same process to the tooth on the right that we did previously to the tooth on the left. It has been cured. Now we're trimming and drilling and shaping the composite resin to make it look more like a natural tooth. Here we see the disking process and some befores and afters. This is one happy young lady.
If you'd like more information about the cosmetic dentistry techniques discussed tonight, or for your regular checkup, you can call Dr. Stewart Brody.